Dementia is a disorder, or rather a disease, where patients begin to become forgetful. They lose awareness of self and their surroundings, and many times it also involves a change in personality. Worldwide, the prevalence of dementia right now, 55 million people are suffering from dementia. And this is a meta-analysis which was done as late as 2020. In Kenya right now, we don't have any prevalent studies. And that is why we are striving to do a lot of these studies.
I was quite passionate about this study because there is a general lack of awareness of dementia in Kenya, and most people don't even know that there's a condition called dementia. And some of them actually die at the community without even knowing that they had dementia at one time. The uniqueness of our study was that we were able to work with neurologists at the Aga Khan University Hospital to be able to access patients who've been characterized to have dementia or Alzheimer's disease. So we've been able to talk to them, talk to their family, caregivers, and talk to healthcare providers who manage these patients. What we've learned is that most patients come to the hospital when they are at advanced stages of dementia.
I am one of 2 caregivers. My brother and I look after our mom. And around, I guess, 2016, not only was she repeating herself, but she was forgetting things. A friend of ours recommended that we go and see a neurologist. And when we went to see the neurologist, they gave the condition a name.
By the time a patient is in the advanced stages of dementia, which is from around 5, 6, 7 years down the line, most of these treatments actually do not work. And some of the drugs we have, they slow down and they retard the progression of the disease.
There's an element of denial and an element of refusing to accept.
And also people start accessing care from primary healthcare facilities. And in these facilities, we don't have specialists like neurologists or people who are trained to even make a diagnosis.
Making a diagnosis of dementia is expensive because some of the tests required, for instance, MRI brain scanning and an FDG PET scan, are investigations that are beyond the financial reach of most Kenyans.
I think all in all, my personal journey or my personal experience has been one of letting go of expectation and allowing myself to just be of service.
For the caregivers, they also don't know how to manage these patients. They are not trained, and most of them don't have support systems. So those are some of the things that we've learned from our study. And the important thing now is to ensure that we have awareness creation at communities so that when they see some changes in their behavior of their loved ones, they can be able to take them to the hospital earlier enough. And also to ensure we have more trained neurologists.
For instance, there are only about 15 to 18 neurologists for 51 million Kenyans at the moment.
Another thing is also to ensure we have diagnostic equipment, even at primary healthcare facilities, to be able then to capture or to get people before they are advanced.
And then we also actually need to get most of our patients linked up to what is called the Alzheimer's Dementia Society of Kenya. This is actually an advocacy group for dementia patients. It helps to give resources to families and caregivers. And then when the patients need specialized care, for instance, towards the later stages, the more advanced stages, you find some patients will be unable to even feed. They have problems with swallowing, and they're able to provide those resources.